All right, so good morning again, good afternoon, and good evening, everyone. So welcome to the webinar today. We're extremely delighted to have you join us for the webinar on practical pathways for change, learning how to integrate a gender and equity lens into AMR research. So whether you're joining us from the comfort of your home or your office, or perhaps during a quick break in your busy day, I want to extend a warm welcome to each and every one of you. So just a brief introduction to me. My name is Erica Westwood, and I will be your facilitator for the session today. So I'm a senior science advisor here at ICARS and a public health specialist, and I've always had a very strong interest in working with vulnerable and marginalized populations, and also for improving health equity for all. And so I'm very privileged to have been able to bring this perspective to ICARS and to speak about these critical issues at their intersection with AMR today. So at ICARS, I've been leading the development of our Gender and Equity Initiative, which has most recently led to the resource document that we're going to learn more about today. So we do have an exciting and informative session lined up, and today we'll be diving into more practical aspects, so how to integrate a gender and equity lens into AMR research projects for exploring new insights and some engaging conversations. So I do want to take a couple minutes to start by explaining why this initiative became important to ICARS. So I see that we have many researchers from our projects online, which is very exciting, and welcome, of course, to all of you. And for those who have worked with ICARS, you know that we always start by talking about what the specific AMR problem is that is being dealt with in a specific setting in low and middle income country context. And this is to inform the development of interventions and implementation strategies that will help local researchers, communities, and ministries to tackle AMR. So in these discussions, we often talk then about who is most affected. And in many settings, we see that there are disproportionate impacts, for example, on women, which could increase the likelihood of exposure to drug-resistant infections, prevent effective treatment, and other aspects like that. So for ICARS to support effective AMR solutions, these must be tailored to the behaviors, norms, and practices within a local context. And so it became very clear that when we started thinking about this, that there were really no resources for AMR researchers specifically who are coming from different backgrounds, such as clinical or veterinary sciences, to better understand where to start if they're looking to bring a gender and equity lens into their AMR research project. So for the idea for this document, the idea for this document was therefore developed to address this gap in the AMR landscape in partnership with IDRC, of course. And at ICARS, we really hope that this will support more sustainable and impactful AMR solutions. So before we begin, I just want to encourage all of you to make the most of this interactive session. And please feel free to continue sharing your thoughts and questions in the chat throughout the webinar today. And it's really your participation that will make our time together truly valuable. So with that, let's begin. So today we have the privilege of being joined by an esteemed panel of experts who will share their insights on integrating a gender and equity lens into AMR research. Our panelists are experts in their respective fields, bringing a wealth of knowledge and experience to our discussion. And each of them has made significant contributions to the resource document, and we're very honored to have them with us today. So without further ado, let me introduce our distinguished panelists. So our first panelist, who is joining us from IDRC, but is also facing some technological challenge. So we're also fortunate to have her joining from space. It's Evelyn Barake. And so Evelyn will provide an introduction and a brief overview of why addressing gender and equity considerations in AMR research is important. And so Evelyn is a program officer at Canada's International Development Research Centre and working with the Sustainable Inclusive Economies Program, where she supports projects to scale up programmatic and policy innovations to reduce, recognize, and redistribute women's unpaid care work in support of a more gender equal world. Her previous experience includes supporting research projects focused on supporting women's participation and benefit from livestock vaccine value chains. And she has over 6 years of experience in multidisciplinary research teams spanning food systems, international development, and gender equality. So our second panelist is Dr. Benshri Namarech, and she is going to speak to us about the process of developing the resource. So over the past 4 years, Dr. Namarech has returned to Thailand and joined the Mahidol Oxford Tropical Medicine Research Unit as a senior social scientist, and she led the evaluation and guided the team in implementing a project entitled Public Involvement to Shape Policies and Solutions on Antimicrobial Resistance. So the project embedded community and public voices in the Thailand National Action Plan on AMR, and she's also a co-PI on this initiative. And finally, our third panelist, our other PI, is Dr. Ingrid Lynch, and she'll talk us through a very practical session to guide you through how to apply the resource. So Dr. Ingrid Lynch is a Chief Research Specialist in the Human Sciences Research Council, specifically in the Public Health Societies and Belonging Division. And she's also a research fellow in Critical Studies and in Sexualities and Reproduction program at Rhodes University in South Africa. So she is a feminist researcher with over a decade of experience working in the field of gender studies, with current projects focused on Eastern and Southern Africa. And she employs a predominantly qualitative and participatory methodologies to examine two interrelated areas of interest, which are sociocultural determinants of health and rights and intersectional gender transformation. And she also holds expertise in critical policy analysis and evidence synthesis. So at this time, we're now going to hear from our panelists, and after that, we'll move into a Q&A session. So please do feel free to engage and ask your questions using the chat box. So the first person to speak will be Evelyn Barake, who will provide an introduction and a brief overview on why addressing gender and equity in AMR research is important. So over to you, Evelyn.
Thank you so much for the introduction, Erica, and for the comic relief. So hi, everyone. It's my pleasure to be here. I'm a program officer with the International Development Research Center, as Erica mentioned, which is based in Ottawa in Canada. For those of you who don't know IDRC, we're part of Canada's foreign affairs and development efforts, and IDRC champions and funds research and innovation within and alongside developing regions to drive global change. Central to this work is the notion that solutions have to be contextually relevant, they have to be locally driven, sustainable, and they have to enhance equity. So IDRC is involved in antimicrobial resistance research because AMR is an international development emergency. By some estimates, AMR can push an additional 24 million people into poverty by 2030. To get an idea of why we should consider gender in a problem like AMR, we can learn from other complex international crises. COVID-19, for instance, which really laid bare how health crises deepen existing inequalities, including gender, but also class, race, age, and geography. Or climate change, where IDRC research that IDRC has supported shows that marginalization and discrimination undermine people's resilience to climate shocks and stresses, and it impedes the recovery process. So these examples give us a good sense that adopting a gender and equity lens to AMR research could be quite beneficial, and that by not ignoring social cultural factors like gender, that helps avoid the development of solutions, be they programs, be they policies or technologies, that risk deepening gender inequalities and other disparities. We live in a gendered world. Gender norms and the beliefs that underlie them are deeply rooted, and they drive inequalities in decision-making and who has access and control over resources. They dictate who plays which roles and who conducts which activities in households and caregiving settings and in crop and animal farming. For instance, women in rural settings all around the world are often responsible for a set of activities that really put them at the nexus for antimicrobial stewardship and zoonotic disease transmission, including tending to sick animals, preparing food, collecting water, and caring for the young, the sick, and the elderly. So if we don't understand how decision-making and access to healthcare, to antimicrobials and health-seeking behaviors differ along gender lines and how these are influenced by cultural beliefs, how can we ensure that our policies and programs will be effective and that they won't reinforce harmful norms and inequalities? The problem is, as most of you who are in this webinar probably know, is that gender analysis remains a weak point in AMR research. There's a big lack of sex disaggregated data as well on antimicrobial resistance and antimicrobial use, and few research projects have addressed the gender dimensions of AMR, especially in the areas of animal and livestock systems and ecosystem and environmental health. So in 2021, IDRC adopted a gender equity and inclusion programming framework to consistently integrate GEI across all of our programming. So this collaborative project that we're going to speak to today with ICARS, which was carried out by the wonderful experts at the Human Sciences Research Council in South Africa and Mahidol University, will directly inform IDRC's AMR portfolio and support our grant recipient research teams, strengthen the gender responsiveness of their work to promote equitable and sustainable solutions to this global challenge. It was supported by the Innovative Veterinary Solutions for Antimicrobial Resistance Initiative, which is a partnership between IDRC and GAMRIF, part of the UK's Department of Health and Social Care. And this Innovet AMR initiative, as we call it, is currently in its second phase. So I'm really honored to be with you at the conclusion of this process to celebrate the launch of this new resource that can help researchers start to plug the evidence gap on gender and AMR and develop solutions to AMR that are sustainable and that support gender equality. Thank you so much.
Thank you so much, Evelyn. So next up, we have Dr. Benshri, and she'll be speaking about the process of developing the resource. So over to you.
So thanks, Erica. So I'm going to take you to how we develop this resource. So the process that we start with the systematic scoping review. We look at the journal article which published between 2017 to 2022. And then the aim was to synthesize any current evidence on integrating gender and equity consideration in AMR research. We focus on low and middle income countries covering human and animal health. So that's a scoping literature. And then next stage, we engage with researcher, which many of you are in the webinar today. Thank you so much. And so we run through the participatory process by engaging with you who work in the area of AMR and gender. And so we do online expert consultation workshop with the map. You can see that we have we engaged 17 experts in Sub-Saharan South Africa and Southeast Asia. And with anyone who cannot participate in the group consultation, we provided opportunity for in-depth interview with individual expert. So we have another additional 4 experts that we run the in-depth interview. After that, we run another co-creation workshop, which to consolidate and to strengthen the material that we have, that Ingrid is going to present today. How are we going to go through and use that information that we found from this participatory method? So we develop the information and result that we got from everyone. So we develop in this toolkit. So I'm going to pass that to Ingrid to go through with you all what we found and how can we use that material. Thank you.
Thank you, Foy. Hello, everybody. It really is lovely to see many of the people, like Foy said, in the chat introducing themselves, and were people who either participated in the consultations or we really poured over your publications to help shape this resource guide. So what I will be doing is I will be taking you through the document, some of the main sections. Of course, we can't cover everything, but I'm hoping that by the end of my session that you'll have some new ideas perhaps that you can implement in your own work, or that it stimulates some questions for you. And of course, we're hoping that you'll download the full guide and that this stimulates curiosity and you want to go through the whole guide and see the rest of the content. The resource that we developed is broadly structured into 2 sections or 2 parts. The first part provides a foundation around key concepts like gender and equity and intersectionality, and also synthesizes a lot of the research that does exist around these interlinkages between gender equity and antimicrobial resistance. And the reason that we spend a fair bit of time on that in the resource is to really help people see themselves in the guide. So because the guide spans animal health and human health, and of course spans many different country contexts, it's important for people to look at the guide and see how gender and equity considerations might be relevant to their specific research area. The second part of the resource, and that really forms the bulk of the document, is structured around the research cycle. And that is where each section or each stage in the research cycle is unpacked, and we consider there in what ways you can apply a gender and equity lens to that particular stage. So I mentioned that we really want people to be able to see themselves in the guide, even though AMR research is so diverse. So what many of you are doing is you're conducting research that might already be exploring gender topics, gender themes directly. So perhaps some of you are working in areas like livestock and looking at women, smallholder farms, and how gender norms and power relations might be relevant to different AMR solutions in that context. Some of you are perhaps not conducting research focused quite so specifically on gender topics, but gender will still be relevant at different points in the project. And then, of course, there are many AMR researchers who are focusing on product development and innovations, developing vaccines, for example. And the guide really also pulls in relevant points for that group of researchers. Next slide. What we did in the guide is to draw on 2 case studies, in addition to many other examples from literature. So we wanted to have a case study that is focused on AMR and human health, and another one that's focused more closely on AMR and animal health. And of course, we know that as a One Health challenge, there are overlaps and interlinkages. The first case study is focused on community-acquired urinary tract infections and antibiotic use among women in Tanzania. And this case study is a gender-specific project. So it looks, the hypothetical research team in Tanzania is wanting to understand the contextual factors around women's antibiotic use better, so that antibiotic stewardship programs can align more closely with the realities of women's antibiotic use and treatment seeking. So that is the first one, and I'll actually refer to this one in the rest of my session, but I'll quickly mention the second one, which is more focused on innovation research. So it's a case study on the development and future implementation of an aquaculture vaccine in Indonesia. And as I said, it's related to innovation and product development, and is also integrated throughout the guide, but we will focus just to keep things a little bit more digestible on the first case study. Okay, so I'm going to share with you a tool that we have in the guide. Something that came out of the consultations, as well as the literature, is that if you are wishing to integrate a gender and equity perspective in your research, it's really essential at the beginning of your project to conduct a gender and equity analysis. There's a lot of theory on how to do this, and there are some really nice tools, but it can be a daunting exercise if you are not someone steeped in gender theory or working in those disciplines. So in the guide, we have what we consider a user-friendly tool that draws on some of the existing instruments. And essentially, it is a matrix, a table that helps you to systematically assess how gender and equity considerations interact with your study topic. So in the guide, in the resource, there's guidance on how to complete it and then to apply the findings from this tool across all the other stages in your research cycle. So as you go through the resource document, you'll see that this matrix actually gets referred to again and again. The tool, I'll spend a little bit of time here so that we can get a sense of how this can be used. This tool has 3 main components. The first is the topic domains at the top. You can see there. So if we're referring to that first case study, if you and your research team is interested in AMR risk and antibiotic use among women with UTIs, you will develop specific topic domains that are important for your research study that help you address your objectives. So in the case study, we used 3 topic domains that are often used in infectious diseases and other public health studies. And they are listed there in those columns. The first one is vulnerability to disease. The second one is people's ability to prevent exposure. And then the last one is response to treatment. So it gets quite granular here, but of course in the resource itself, this is unpacked in more detail. So that is the first area of focus within this tool, the topic domains. The second component then is the gender analysis domains that you can see running down the left. And what that part of the tool does is it really distills a lot of the gender theory into what has been found to be 5 commonly occurring domains in terms of how gender relations, gender norms, power relations, how they manifest in different settings. So these 5 questions can really help guide you to explore and sort of break down how gender and other equity considerations relate to your research topic. And I'm going to take us through, I think, just 1 or 2 examples of that to illustrate that to you. So the next slide. If we take the one question there, who decides, that refers to the gender relations domain of women's decision-making that Evelyn already mentioned at the beginning. And if you are in this research team in Tanzania completing this matrix for your project, something that you would do is you would use a desktop review to populate it. You can use existing national survey data. You can even conduct interviews if it's possible for you to do that, if it's not at a stage in your project where you're not yet doing field work. So what you would do is you would use that desk review to populate these cells for that gender relations domain of women's decision-making. Finding from the literature that would be relevant there is that in survey data, in national survey data, 2/3 of married women do not have a say in how household income is spent or how they address their own healthcare needs and treatment decisions. So that is going to be important for your study. It's helpful to have that information. If we look at a second example, norms and values and the impact of those. Yeah, you can, it's quite small on the slide, but you can see that on the left. There's one of the gender domains. Another research finding that would be relevant for the team here is the fact that UTIs as a women's sexual and reproductive health concern is often stigmatized. So different beliefs and perceptions around that can actually discourage women from seeking treatment or might result in them opting for unprescribed antibiotics. So that's a finding from Russ and Beria, actually, who did research in Tanzania around that issue. The third component, I said that this tool has 3 different components. The third one is then where you can bring in biological and social stratifiers that are relevant to gender. So this is where you can really engage other equity considerations. In the context of this case study, a literature review that this hypothetical team conducted found that education level, and area of residence were 2 important variables. If we look at area of residence, only 44% of rural women have access to basic sanitation in Tanzania. So that impacts their menstrual hygiene management, it increases their UTI risk. So as you continue populating this tool, you can see how it starts really building a picture for you of the context within which you will be conducting this research. And I'm sure you can already see how it could guide different areas for you to explore in the study. So in the resource, there is a section then that actually helps you to apply those findings. So you might, for example, identify an area of inquiry related to those gender domains that you want to pursue. For example, if you see that women's treatment decision-making is going to be relevant, then that is something that you can decide to include as a key area to explore. it can help you map which social and biological factors are relevant to your study, so that you perhaps can make decisions about different subgroups to explore in your research. We already saw there that rural and urban location is important in healthcare access in this setting. And then, of course, as you complete this tool, because there is so little at this point around gender equity and AMR, you might find that some of those cells you can't populate, and or there's very, very little research, and it can guide you to identify some gaps in current evidence that you might wish to explore in your own research. Okay, so we've paused on the tool for a fair bit of time, but I want us to also look at some of the other features in the document. So this gender and equity matrix was, as I said, in stage 1 as part of the problem identification within this guide. And at the end of each section, each stage in this research cycle, we include a checklist. It's not meant as a tick box exercise. It's really meant to prompt reflection, to help you to think systematically about the different issues that are raised in that section in the guide, and to really interrogate your own thinking. I think sometimes it helps to have a guide like that. Next slide. Here, I'm going to just touch on the section in the guide that deals with implementation and data collection, to give you an example or show you how the case studies are featured in each section. So on the left there, you can see those 3 points are covered within the guide or in the resource in a lot of detail. But if you go to the next slide, Boy, I'll share with you how the case studies are used throughout to pick up on some of that content within the resource and illustrate in a practical sense how it shaped decision-making in a project. So in terms of, again, our Tanzanian research team, as they proceeded through their project implementation, this team constituted a community advisory board at the beginning of the project. And when they shared their data collection plan, this advisory board was concerned that having mixed groups of men and women participating in focus groups, which was one of their data collection methods, that might constrain women's participation, particularly in that setting where local gender norms discourage women from sharing their views in an open forum like that. So the team decided to have separate focus groups for men and women. They also decided that they will schedule those at times that are best suited for men and for women, considering that women often have other caregiving and domestic tasks that can prevent them from participating in research. And they also realized that they will need to offer childcare and transportation reimbursement for participants to also just remove some of those barriers to participating. And then finally, they ensured that the focus group discussion facilitators are trained in gender and sociocultural sensitivity. And in the resource itself, we go into what that training, for example, might entail. I'm moving us on to stage 4 that focuses on data analysis. In this section, we cover some common pitfalls when incorporating gender and equity considerations in data analysis. So there we distinguish between things like sex and gender in your analysis, several other things that can occur that you would want to avoid. But then importantly, we also bring in the gender and equity matrix to guide your analysis. So I mentioned that it features throughout. This is a nice example, I think, of where I can share a more complete example. So you can continue to the case study slide, Boy. So here, this is now the point where this team, they have their qualitative data from their focus groups transcribed and they're busy with analysis. And that completed gender and equity matrix can again guide them here in how they explore gender within the data set or different gender variables. So the team decided to populate the cells of that matrix with their data, their transcribed data. So just looking at one example here, they were coding their data for the topic code of vulnerability to illness, which was one of their main topic codes. And then they wanted to see how decision-making authority, if there was, if that emerged as the code in the data set. So I'm going to just read out those two participant quotes for you that were both coded by this team under that gender relations domain and that topic code. My husband, this is now a female participant in one of the focus groups, and she's from one of the rural sites. My husband decides when I can go to the clinic, even if I'm feeling sick. Sometimes I have to wait for him to come home before I can go. The clinic is not that far. Another participant, also a female participant from an urban site, shared, my partner is away for work in another town, so I make my own decisions. Usually I go to my pharmacist and she gives me what I need because I've had these pills before. It's a bit different when my partner comes home, then I must wait. So this is just a quick snapshot of, I think, something that I definitely think is really helpful in the guide, that it breaks down the different, the content and really provides examples of exactly how you would apply it. And of course, it will, you will adapt this to your own project, but I think it's really helpful sometimes to see how this is done in practice. The final section in the guide, stage 5, is focused on reporting and dissemination. And we cover the gender sensitive and inclusive language and representation, as well as dissemination practices. Again, I'm going to just give an example of how, in the case study, this was the principles that we share in that section were applied by this team. So the team was, when they were doing reporting of the findings, they had a community engagement event, and they wanted to use some of the photographs from that event to include that in a research summary that they were producing, a research brief for local decision makers. And that is something that we often, I think, many of us produce for our projects. Participants were provided an opportunity to review this draft output, and most were pleased to see themselves and their contributions represented. One of the participants, however, noticed that despite indicating on the day that she did not want to have a photograph taken, she could be identified in one of the images, and the team was able to replace that image. So this is really then capturing a few of the principles shared in that section. In terms of dissemination, this research team decided to also conduct radio interviews and to share findings with local communities. And when planning for these, they decided to prepare a guidance note that summarizes the key ideas so that they can have some of the junior team members who reside in the study area also feel confident to participate in these radio interviews. And that was an intentional strategy to ensure inclusivity in the team. This also helped to ensure that the findings were then shared in local languages. And what they also included was some content in that guidance note on gender sensitive and culturally appropriate language. And they developed this note, and they had the community advisory board review that, and a senior team member with gender expertise reviewed that, and it became a resource for all of them to draw on during dissemination. I think what was nice about this case study, if you look at the full details in the resource, is that these were all decisions the team made with the fact that they had a small budget in mind. And you can see how it's still possible to integrate these principles, even if you have perhaps some constraints. So I'll end off here. I think I want to just emphasize that, and hopefully you picked up on this as I went through some of the content, that this resource is not prescriptive. It's really intended to stimulate your own thinking and your own creativity to see how you can incorporate some of these ideas. It's also structured in a way that helps you to be systematic when you do that. And then it offers, of course, practical tools and strategies so that even if you're not familiar or comfortable even with gender theory or a lot of the other resources that are perhaps more generic, you are able to find very concrete ideas that you can potentially apply. And I think something that is highlighted throughout the guide or the resource is that these different tools and strategies, they're all really meant to strengthen your project. So if you are able to integrate some of these ideas and practices, you are increasing the social relevance of your work, you're increasing the quality and the impact of your research. I'm going to end there. Thank you, and hand back over to you, Erica.
Great. Thank you so much for your excellent presentation. I think one of the great things that I hope was well highlighted and what everyone was able to understand is that there's very practical case stories in the guide and in the resource document to really try and bring these issues to light and to give very on the ground examples of how gender and equity and AMR all come together, but also how projects can then better integrate responsive strategies as well. And as you saw when we were flipping through the slides, there's also a checklist of very practical items. I think the case studies were more important to focus on today, but then you're welcome, and we would highly recommend that you take a look through the guide as well and look at those practical strategies and think about what you can do in your own work as well. And then I think just to give one final reflection from me before we open to the questions is that, of course, that this is a guide meant to supplement the work that's already being done, a resource that's meant to add that value, but it also is no replacement for bringing that expertise onto your team as well. If this is something that you're looking to implement, and if you're looking to develop quite gender transformative solutions and really trying to bring a progressive gender and equity lens into your research, then of course it's always this document is intended to help researchers understand this important issue and understand strategies. But of course, we always need to have multidisciplinary teams to respond to these challenges. So with that, I will say that we have covered a lot of ground and gained very valuable insights about the document and how we can actually apply that in our projects. But now we want to open the floor to you, our participants, and everyone who stayed on for the Q&A now. So we would like to hear your thoughts and questions and reflections. So this is also your opportunity to dive deeper into the topics that we've already discussed, but also to seek clarification or additional perspectives from our experts on the resource document. So if you do have some questions on how you can apply this, some of the strategies in the document, or any experiences you'd like to share, please do put that in the chat, and we'll be and then everyone can respond to those to what's raised. But while we gather the questions from our audience, I do want to mention that we're also going to put a short poll out to you and this will be after the session, after the Q&A session. So please keep an eye out for that in the chat. But to get us started, I would like to just start with asking one of my own questions. So really, there are a lot of strategies in this document. There's a lot of really great actions that research teams can implement throughout the research cycle. But we also know that there's some projects that are even attending the webinar today, and they already may be at the start of implementing their project. So they're already, let's say, in data collection or moving into analysis, and they haven't done the gender analysis necessarily. So for those where the work is already underway, how could they make the most of the different suggestions in the resource, and what can they do when they're already in the amidst implementation?
Something that I've been thinking about a lot is this idea of incremental change in whatever it is we do. I think something that prevents us to tackle things that are new is often the idea that you need to get it right the first time. And yes, we want to be very conscientious and responsible in our research, and not rush in and do something just for the sake of taking a first step. But I think drawing on this resource and other resources out there, I would encourage people to take some steps and to consider this as anything else that they've been tackling in their career. I'm sure there are many examples where as we develop new methodologies, new research areas, to consider it as a journey. So what makes sense for you to integrate now that's feasible if you're already in implementation, that is possible to do within perhaps budget restrictions, and integrate those principles and almost take that as an opportunity to see, is it working? Is it something that you can do again in other projects? And yes, adopt that perspective of a journey, and not wanting to do it right or wanting to do it comprehensively from the first moment.
Great. So it's better to start small and move your way to doing more. And I think that's a great way to think of it as a journey. I'm not sure, Evelyn, Dr. Benshri, do you want to add anything onto that question?
I could come in quickly and just say that the guide is so well structured. So as you've seen in the slides, there's the different parts of the research cycle. So I think somebody could just flip through and look at where they are in the research cycle and see what of the checklist of the recommendations is applicable and feasible within the constraints that you have, and start there. And yeah, just echoing what everyone said, the goal is not to hit every single check mark in the guide on every project. It's an approach that we hope, it's a guide that we hope you can reach to many times over the course of a career and apply different elements of it every single time, depending on the nature of the project.
As Ingrid mentioned at the end, that it's not prescriptive. So whatever that you are in any cycle, you can pick up anything at whatever stage that you are doing. And when you have chance to go through the material, there'll be something around monitoring and evaluation that you can see that you can integrate into throughout the cycle, even though we are not mentioning here, but it's integrate into the material that you can read through, and it will take you through the process of whatever you pick up.
Great. And I think what's very clear to me when I've looked through the checklist, just building off what the two of you have said, those are not all items that need to be applied based on having done the previous stages. There's a lot of things that are very specific to different stages. So it doesn't mean that you have to have done a gender analysis before. There's also things, especially when you're looking at reporting and dissemination, there's a lot that we can apply. I don't think we have any other questions in the chat. I do think there are some questions out there, because I know I've spoken with research teams and this has come up with a lot of, there's been a lot of discussion. So, we do have a quick question. Carries, do you want to come in and give your question, please?
Hi, yes, if it's all right, it's probably quicker for me to unmute than type. So I was just going to ask, so I was looking at the gender analysis matrices, and they look really helpful. But I was having a quick look and seeing, I couldn't see very many examples in the literature of ones for applying the gender to veterinary research, which I realize is kind of one of the problems that you guys alluded to earlier. Are there any suggested resources that you know of that apply that to research on veterinary things or agriculture or anything along those lines, really?
So I know that was a big discussion that we've had quite a lot of. Ingrid, I see you turned your mic off. Maybe I'll start with you, but Evelyn, I will definitely ask you to come in as our animal health funder.
Yes, I agree. Evelyn will be able to share a lot on that. I just want to quickly mention that we did make a point of integrating other research and examples throughout the text. So the two gender and equity matrices are based on the case studies, and you would have seen it's the one, the UTI, sort of a public health example, and the other one is focused on aquaculture.
Yes, I did see the vaccination one as well.
Right, yeah. So within the text, I think as you go through it, you'll find that there are other references specifically to veterinary sciences, animal agriculture, woven through. And I think one of the reasons we were able to do that is because that is one area where there's been a wealth of gender research, even if it did not necessarily in a particular study link with AMR directly, but there really is a lot that we could draw on there and then apply to AMR research within the guide.
I can come in here as well. Thank you so much for the question. I'll provide a little bit of background on the history of this project. Perhaps that'll be helpful. So both IDRC and ICARS are really interested in this subject matter area. And from where we sit at IDRC, I was initially in the animal health program. So our interest was really to look at gender and AMR from the perspective of projects focused on animal health, specifically the development of solutions for animal health, so vaccines, but also alternatives to antimicrobials, and increasing access, uptake, and use of those solutions, especially among women and men smallholder farmers. So that was really our motivation for undertaking this project. And the beginning of the project was there was a series of roundtables where we invited experts from across multiple One Health spheres, practitioners, researchers, policymakers, to really frame this issue for us, to identify some gaps and do a little bit of a prioritization exercise. And those roundtables then fed into a request for proposal, which was the call for this particular research project. So that really helped frame what we wanted to do with this guide and the desk review that also informed the guide. And that's where HSRC and Mahidol came in to undertake this work with us. So throughout, the emphasis was really on a limited One Health approach with an emphasis on human and animal health. So the guide was very much developed to be useful for both public health, human health researchers, but also animal health researchers. And throughout the kind of research innovation cycle from product development to implementation research. So we really hope you'll take the chance to look at the guide and find it helpful for animal health researchers. A lot of the researchers that were consulted in the development of the guide were also from animal health disciplines. Thanks.
Great, thank you.
Great. And I see there is the poll that's just come up, and that would be very helpful if you could answer that, because it'll help us think a little bit more about where this guide could go. But I do actually want to also just mention Zoe Campbell in the chat has mentioned that she works at ILRI, and there's some colleagues that are working on a gender and AMR framework. I'm very glad that that was mentioned, because I know ILRI is one actor that's doing a lot of work in this space, with as well as the wider CGIAR group, and FAO has also done some work. So we are not alone in the animal health space either. So there are others contributing. But let's move to another question. So actually, we have two questions that both start to speak more at a policy level. So one asking if there's any frameworks with which to begin adding gender to AMR national action plans, but then also on a similar line, I think, there's a question about in terms of stage 6, so thinking more about how we are using the research, how can we actually ensure that this is being used by policymakers. So this individual is coming from a poultry production in Senegal perspective, where gender and equity are not currently an established lens. And so they're wondering how this can be used in policy impact planning. And so I don't know if anyone else has an immediate reaction. One thing I would actually like to say to this, so there's a group of informal experts that has been advising the WHO on an evidence brief on AMR and gender. I think there's a couple other members on the call. I'm also on that group. So, and it was discussed on a previous webinar this week. So this is actually something that will be coming in 2024 from WHO in terms of advising more at a policy level. But this is not the only action in this space. So maybe our team can also speak to anything the guide might help provide, or other resources that can help informing a gender and equity lens at a policy level or national action plans.
I think I'll just add that it wasn't a big focus of the guide. The focus was definitely to speak to researchers It's something that we discussed a lot because that definitely is a need. I think what Erica shared about other developments in this space, it's so valuable because there are people responding to issues like that. So yes, the guide is focused more on researchers, but at the same time, I think there are valuable principles to be gleaned for people working in program development, in policy development. And I think the gender and equity analysis matrix, for example, can easily be used for a policy planning process, for example. So I would still, I think, go through it with that lens and see what you can glean from that perspective. And of course, I think for people working in policy development to see if they can popularize this resource and some of these other resources out there with the researchers in their network, so that they ultimately, if we're thinking long game, start getting the kind of evidence that they can use that does integrate a gender lens when they are in policy development processes.
Dr. Ben-Shri, do you want to add anything from your experience from the Thai National Action Plan development, or because I know you've had some work in this space as well?
As I put in the chat, that we learned that as the gender is one of the SDG, so we have seen some of the gender has been put into the indicators in the Thailand National Action Plan. And so, as also you mentioned, Erica, that WHO has interest in gender. So there are groups of people who work in gender and adding those AMR in that. So I'm pretty sure that there will be some movement in terms of adding gender into AMR and other aspects. And I'm sorry, I haven't really followed in terms of the new indicators, whether there's any particular gender add into the indicators of WHO on AMR. So, but as a movement, I'm pretty sure that there will be those kind of indicators coming in the near future.
Thank you so much. And I know we have some more questions, but we are at the hour. We're actually 1 minute past and we need to end on time. So I'm very sorry to those that we didn't get to answer. Maybe if anyone can answer in the chat from our panel while we close, that would be great. I think we'll leave the Zoom open for a few minutes so we can gather any responses. But just a huge thank you to everyone for joining us today. I think this has been an enriching experience, and it was great to see the conversation that we were able to start getting going. And so I just want to also express my gratitude to all of our panelists for joining us today, but also all the work that has led us to be able to produce this resource. And so you can download the Practical Pathways document. It was shared in the chat. It's also hosted on the ICARS website in our Knowledge Hub. And I think that's useful in many settings, including informal settings, which was asked about. And this webinar session has also been recorded and will be shared with all of the participants. And there's also been an evaluation form put in the chat for the webinar. So that will just help us to think about what we need to do next time we're hosting a webinar. And finally, there is a newsletter also that has been developed by Jive Media, who is also a partner on this. And I think they can they've put the link to subscribe to the newsletter in the chat. So if you'd like to hear more about this initiative, please do subscribe and you may get some more information that could be useful to you in the future. So as we bring this to a close, I just want to encourage you all to carry forward the knowledge gained today and continue the conversation in your respective networks, advocate for this issue within your teams at a policy level and in the spaces that you do have as well. So the impact of our discussions, we hope will extend beyond this space. So thank you so much, everyone, and take care. Have a very lovely day.